Hey guys, so my name is Danielle KB and I did my presentation on the bubonic plague, and this is probably around the 20th time I've redone this presentation, so hopefully I don't have to restart it again. So the bubonic plague I chose just because I wanted to know more information about it, really no specific reasoning. So this was taught in many history classes through my education at least, and it's also called the Black Death because of the necrosis of the tissues. So what exactly is it? This is an infectious disease that affects rodents, animals, and humans. So it's caused by the bacteria Yersinia pestis, which is found in many areas of the world, including the United States, and it typically occurs seasonally for those that are more susceptible and more in contact with those small mammals and rodents. And this occurs around the time of usual seasonal allergies. So, what causes it? As stated previously, this is caused by Yersinia pestis, which is a bacteria that is usually hosted by a flea that gained it by a small mammal while feeding. So, when the flea becomes infected by the rodents, which are usually the small mammals such as chipmunks, squirrels, mice, so once they're infected, they can transmit this bacteria to humans and other mammals during their feeding periods. So this bacteria survives a couple days and survives in the blood of these rodents, and when the fleas feed on the rodents, the fleas also hold this bacteria for longer. So, a little bit of background on Yersinia pestis is that it was formerly known as Pasteurella pestis. So, someone named Alexander Yersin found this bacteria in China during a pandemic in Hong Kong. So, it originated in China, and I'm assuming that they just wanted this bacteria named after them because they changed it, and you can see Yersin in the beginning. So this bacteria is gram-negative, non-motile, it's rod-shaped, and it's a Coccobacillus bacteria, which lacks spores. So unsimilar to E. coli, there are no endospores. So this is a zoonotic bacteria, which basically just describes how it's transmitted between animals and people. So it's just a very broad and general term to classify it. So this bacteria or organism is anaerobic, which means it doesn't need oxygen to survive, which is crazy to think about. And it's spread through the Oriental rat flea. So there's 3 different types of the bubonic plague. Bubonic is typically localized in the lymph nodes when they become swollen, and it's very visual, as you can see on the right. It just describes the symptoms systemically, centrally, and through other body systems. So the bubonic it really just causes those flu-like symptoms with fever, chills, headache, weakness. It becomes more advanced when you get into septicemic. This is where it becomes more involved in your bloodstream. So you have tissue death, otherwise known as necrosis. So there's blackening and death of tissues in the extremities specifically, so your nose, fingertips. So you're going to have all the symptoms of the bubonic, but it's just more severe, and now it's affecting your tissues. Pneumonic is when you have a cough, so it's kind of like pneumonia, where you're constantly producing sputum. You're out of breath because your lungs are affected, and you have vomiting, you have the fever, headache, and also chest pain. Both septicemic and pneumonic can be very severe if not treated properly with the antibiotics. So, medical diagnostics. This is mainly just laboratory testing. So, typically, if you're in a healthcare setting, they'll just gather a sample of your pus, blood, or sputum, and they'll test for the antigen. A new commonly used one in Africa and South America is the rapid dipstick test, which is more just rapid. It's faster, and you can see. So the medical treatment is the use of aminoglycosides, which are a form of antibiotics. So you'll use streptomycin, gentamicin, which are used for the plague. Streptomycin and gentamicin are very basic antibiotics that are used in many other bacterial diseases. So these antibiotics focus on the aerobic gram-negative. Now I know this one's anaerobic, but it's being shown to be the most effective. And the rates for mortality have gone down greatly. So other therapies can also be used, such as fluoroquinolones, tetracyclines. These are also very broad classifications, so these meds can also be used in pneumonia, UTIs, skin infections, gastric enteritis, inflammation, pretty much anywhere. You use them in bone diseases, skin diseases. For the plague specifically, these antibiotics are not as effective, and they're really not studied as much in the plague. So the history behind it, it was introduced in the US in 1900. So like everything, it had to originate somewhere and then was then transferred and moved all around the world, basically. So the plague specifically affects all ages. It's not very specific on gender, race, ethnicity. It just affects everyone. And 50% of the cases occur in people 12 to 45, but it can even affect people up to 96 years old. The World Health Organization documented that there's only 1,000 to 2,000 cases each year reported. They don't necessarily think it's accurate because of the developing countries and their numbers might be off there, but it's pretty close to the numbers. So the epidemiology, as you can see to the right, the world distribution of the plague, and the yellow and red. So, like I said, in multiple slides, it's caused by Yersinia pestis. Now, in the United States, we really only have 1 to 17 cases nowadays, according to Virginia.gov. And most cases occur in the rural and semi-rural areas in western United States. The main countries affected are the Democratic Republic of the Congo, Madagascar, and Peru. So what does it do specifically? The plague really focuses on the lymphatic system, and that is where it goes. So when you're infected, your inflammatory response begins, and so your lymph nodes are affected and impacted. As you can see to the right, it says in the Middle Ages, which says 1400s, millions of people died from the Black Death or bubonic plague, and this was because we didn't have antibiotics back then. So now we've reduced that number so much, probably like more than 99% because of antibiotics. So Specifically in the body, the bacteria goes into the body, and once it reaches the lymph, uh, it can spread extracellularly, leading to the septicemia and the pneumonic plague. So, the forms of the plague, bubonic is more localized due to the bite, and if not treated properly, it can lead to septicemia and pneumonic. So, septicemia is in the bloodstream. So, the skin and tissues will have necrosis, so they'll turn black and die. So, the fingertips, the nose, extremities, they'll turn necrotic. So, pneumonic is very serious because it's very similar to pneumonia. And once you have that breathing complication, the risk for mortality is increased greatly. And this is usually because of droplets inhaled. So the transmission from human to human is typically because of the direct contact with infected tissues and fluids. So while in the healthcare setting, isolation precautions such as droplet contact will be used, which really just includes mask, gloves, hand hygiene, similar to what's used for COVID-19. Except you can use a regular surgical mask and you don't have to use a N95 respirator. So these people can become infected simply by inhaling droplets, but the human to human transmission rate is really rare, because you're really not gonna be having that direct close contact. So the mortality rate in the past was around 66% in the United States, but even before that, the mortality rate was basically guaranteed for people, especially in the Middle Ages. Now, because of antibiotics, we've reduced it to 8 to 10% as documented by the World Health Organization. So preventing this is usually and typically just hygiene and being very cleanly. So in your house, you want to have rodent proof. You want to leave that pet food on higher areas. You don't want to have dirt in the corners. You want to keep your pets free and clear of fleas, so visiting the vet, wearing gloves, and using insect repellent when necessary. So finally, the known reservoirs. As you can see on the right, you can see the infection pathway and how it works from the flea to the rodent. So the known reservoirs are the fleas, rats, mice, squirrels, rabbits, chipmunks, really any small mammals that can be bit by a flea. So basically anything outside. This is really becoming rare nowadays, just because of our technology and our sanitation. So that is the end of my PowerPoint. Here are my references, and thanks for listening. So there are several risk factors for this. A main one is just poor sanitation. It occurs more in those developing countries because of their lack of sanitation, and those who live in those crowded areas in rural and semi-rural areas, and those places with the high rodent population habitat. When you think about the pandemic that we're in right now with COVID-19, you want to always maintain that 6 feet distance. So if you think about this, when you're crowded, many organisms, bacteria, diseases, viruses, they spread more quickly because you're in close contact with people that you don't even know. So you're in contact with many things. So your immune system's always working. So the main careers that can be at risk for this are veterinarians and their assistants, because of their contact with animals. So if they're always following those precautions, then they really do decrease their risk of getting it. But if they don't, they're really increasing it because they don't know what these animals and small mammals have. Another risk factor is those who camp, hunt, or hike frequently because they are in close contact with the elements and the rodents and fleas.